bring them to the show. Wednesday mornings, it's Dr. Joe Congini at this time, Sports Medicine Center, and Dr. Joe on board with us again today. Joe, what do you have on your list for us?
Hey, Ray, this might surprise a few people. I think most people think that, hey, with sports medicine, especially this time of year, we'll be talking about some musculoskeletal problem, shoulder, ankle, or something like that. But one thing that I'm getting the most questions about, and I think the most talked about in town last week, as I was at a week one game, a lot of people talking about the cancellation of last week's Norton High School football game.
Yeah.
Week one, and just what that might be related to. And I just wanted to highlight or update a few things. In sports medicine, of course, we do musculoskeletal problems, but we also take care of medical issues. And so the medical teams were involved. But the real key for this problem is the pediatrician. And so the issue that caused the cancellation of the game was a viral condition known as hand, foot, and mouth disease. And really what was the issue was what was already a pretty significant outbreak from what I hear. I don't know the details with the Norton thing, except there have been several articles in the paper about it and in internet and other things that I read. They don't want to make even a more widespread outbreak. And so from that standpoint, I just wanted to mention hand, foot, and mouth. A lot of people were scratching their head and had not heard of this. A lot of parents have heard of it because hand, foot, and mouth disease is a real common and very contagious virus. It is most often seen in a population of younger kids, age 3, 5, 7. It's really kind of the scourge of the daycare population, and a lot of people end up having to miss daycare and be out of daycare, or they spread widespread in daycares. But it can definitely happen in school-age kids and high school kids, as we know in this Norton situation. And so the way it presents with fever, sometimes a pretty high fever, 102, 103. These kids start to they have an incubation period, so they don't have the full-blown presentation right on day one, but on day 2 or 3 they get this, but they get these painful red blister-like rashes in the mouth, on the hands, and on the feet, just as it's described from this viral condition. And it causes people to be these young kids, very fatigued, a word we use in medicine called malaise. That means they just feel crummy and tired all the time when they have it, and they feel weak and even painful. And so not ideal to be out doing a lot of things activity-wise. And so with these outbreaks, a lot of times their kids are restricted from school and other things. And a lot of people also asking the question, isn't there some specific treatment? Is there an antibiotic or something? And no antibiotics work. A lot of people are mistakenly given antibiotics, but of course the pediatricians who see this so often know there's no antibiotic or anything that's a quick fix. What does help some, if kids are really struggling, are the fever reducers, maybe Tylenol, ibuprofen, and rest. And then the big thing is avoiding dehydration. Definitely for our athletes, definitely for our football players, and I know everybody was talking about this a lot. This is a key time of the year to be built up, and what happens is it actually kind of is painful to eat and drink, and so people get athletes get really dehydrated, and so there can be outbreaks in school and certainly outbreaks in high school teams, and so the decision is not to take a chance on making it a more widespread outbreak, and so keeping kids out of sports and football. You have to avoid contact, really good hand washing, no sharing of utensils and water bottles and things like that. So we got to go back to, we talk about that a lot for a lot of viral infections, making sure that we do all those basics. And then it usually runs its course in about 2 or 3 or 4 days. And when kids are ready to return is usually in that, say, 3-day period, 4-day period, when the fever goes away. When the fever goes away without having to take Tylenol. So if kids are still taking Tylenol and the fever's going down, but when they get to the point where they have no fever anymore without the fever reducers. usually totally better by 10 days. If they're not totally better by 10 days, they might need to be seen. And most of the time, these are managed by our expertise, and I talked to a few of our pediatricians about it. This is right up the alley of the pediatricians. They see a lot of hand, foot, and mouth disease. The pediatricians and the nurse practitioners and the PAs in the pediatric offices see these. And generally, the kids are really coming around at about 5 to 7 days, and it looks like the outbreak has been stemming the tide, as it looks like the football team is going to be able to play this week. But I have to admit, this was a pretty rare presentation in a career of around 40 years. I've seen other contagious viral illnesses cause problems, but I haven't seen this with hand, foot, and mouth disease. And so there are just one thing people were talking about a little is there's some very rare long-term complications that are neurologic and very, very rare anything related to heart complications. So it really doesn't have much in the way of long-term complications. Kids may lose their fingernails or toenails and things like that, but no very significant risk for neurologic or heart problems. People were mentioning that, and those are really rare with this problem. So generally, everybody gets better. It is a matter of waiting time. There's no way to speed it up. And a lot of times when there's outbreaks, you certainly don't want to spread, make it even more widespread. So people make decisions on staying out of activities and staying out of school. And so we get all kinds of medical issues that affect athletes too, Ray, and this was one of them that I just wanted your audience to certainly be up on.
Joe, I remember years ago, and I'll date myself here, going back to the late 70s, early 80s with our football team, we actually had to cancel one of our games, and I'm sure you can relate here, because of staph infections that had hit our locker room with our football team, and you don't hear too much about that anymore, but a staph infection had hit some of the athletes in our clubhouse, our locker room, I should say, with our football team, and we had to have a game canceled because of that.
You know what, Ray? Gosh, you bring up a lot of good points from that are current, and then we remember how many places, how long we've been through this deal.
Yeah.
Me a little bit longer than you, but there was a period of time where there was really a bad type of staph that was in several locker rooms that was causing really significant problems, all the way up into the college and professional level. Mm-hmm. And wow, that's the bad memory day. Now the staph, if you caught it early, there were antibiotics and things, but you are absolutely right. There was a lot of cancellations due to some really bad staph infections. And let's just say that we're very happy that much of the bad staph seems to be in the rearview mirror and behind us.
Isn't it amazing, though, Joe, when you talked about this thing that broke out at Norton High School with the football team, that with so many teams and so many people using and sharing locker rooms these days, that actually we don't see more of that. And that's a credit to the medical profession, I think.
It really is, and this is one where the light shines really brightly on the pediatricians. They really know right away, and they really get on these things right away and make sure that they do a little quarantine with these kids in the first few days, and then they won't spread. And so this is a shout-out to the pediatricians today. They do a great job treating hand, foot, and mouth, generally in the younger kids, but in this rare situation in high school kids. You're exactly right, Ray.
All right, Joe. Great stuff this morning. Thanks for hitting it. Very timely. We'll do it again next week, my friend. Have a good holiday weekend.
Oh, you too. Thanks, Ray.
You got it, my friend. Dr. Joe Congini, he's the best part of this morning show for over 30 years here on 93.5, 1590 WAKR.